Good morning, good afternoon, good evening, wherever you are. There's a looming scandal of around 11 billion in SHA. Not forgetting the transfer of system from NHIF to SHA costed around 104 billion. And the only referral public hospital in Kenya called Kenyatta National Hospital is on the verge of getting shut down because of lack of operational funds. And this is 13 years later after devolution. At this point, each county is supposed to have its own referral hospital. Kenyans are not supposed to be subjected from moving from one county to the next, seeking medical assistance. That is so wrong, because if you ever went to Kenyatta Hospital, you'll find a Kenyan from maybe like Busia. They are over there seeking medical assistance. Someone else from Mombasa, which of course that's so wrong. And the same facility now became overstretched, because now it's serving countrywide, of which it was not supposed to be doing that kind of work. It was supposed to serve a certain capacity of people, but not the whole population. And yet, it's not that there is lack of money, but it's the looting that it is the problem. Mind you, the same facilities in the healthcare system is whereby you're lacking basic necessities like medicine, enough beds for patients, because in some scenario you're finding one bed is being shared by two patients. In other cases, even some patients are sleeping on the floor. And that is 13 years later in devolution. And healthcare is one of the sectors that was devolved in the counties. But it seems they have absolutely messed up, because these are not things that you are not supposed to be experiencing right now. Because Kenyans right now are supposed to be accessing quality and affordable healthcare, not the other way around. And one thing I would like to say that any elected leader, from MCA, that member of parliament, senator, women representative, governor, president, cabinet secretary, they have no moral authority to tell Kenyans that either the healthcare, which is SHA, is either working or not, because they are not using it. They already have their own private healthcare coverage. A good example is like the Mosop member of parliament, Abraham Kiro, who was in Dallas, United States of America, for 22 months receiving treatment over there. And yet here again we have Kwanza, member of parliament, Ferdinand Wanyonyi, currently is in India receiving treatment. And yet these are the same people who are going to come and tell you the healthcare system in Kenya is working, and yet they are not using it. When they get sick, either they go to a private hospital, and if things don't go well over there, they go overseas to receive treatment. And mind you, the healthcare practitioners, they are always on the street demanding their pay, because most of the time they normally go like 3, 4, 5 months without pay. Their working environment is not conducive. Other claims is all about promotions. You find most of the promotions are not handed out due to merits. It's all about tribalism and being biased. And this is what has affected our current healthcare system. They normally say that you are like one sickness away from poverty. That is a reality in Kenya. Because right now in Kenya, a common mwananchi, when you get sick, with the little money you have, you just head over to the chemist, buy drugs over the counter, and you diagnose yourself. Because majority don't have enough capital to either purchase the private healthcare insurance. So that is at this point in time, we can categorically say that the healthcare system has already collapsed. It's just because it was not designed to benefit the common mwananchi. It was designed to just benefit a few individuals who are now just profiting a lot from it, and that is the bitter truth of what things are normally transpiring out. So